I know I usually start with the numbers, and those numbers are important, and I'll circle back to them, but I want to take a moment to talk about some different numbers. I want to talk about the thousands of first responders and medical professionals and clinic support staff on the front lines of COVID-19. I want to talk about the thousands of teachers doing their best to continue educating and supporting our children through this difficult time. Thanks as well to the grocery clerks and gas station attendants and warehouse workers and delivery drivers. A big debt of gratitude belongs to the millions of Wisconsin residents protecting each other by following Safer at Home, because we know that flattening the curve is how we save lives. And I want to acknowledge those of you worried about loved ones who are sick with COVID-19 and to honor those who are grieving loved ones who have passed away. This is all difficult work, and I want to acknowledge and thank you for that work. Staying safer at home is so important, but we know that it isn't easy. We want to make sure you have the tools to care for yourself, to stay connected, and to reduce stress when possible. And our website, resilient.wisconsin.gov, provides information on these tools and additional resources to explore about caring for yourself, about staying connected, and about reducing your stress. It may seem selfish to prioritize your own needs at a time like this, but in reality, it's not selfish, it's self-care. We need that self-care to deal with our stress and make it possible to care for others around us and stay connected. Supportive relationships keep us grounded, and physical distancing can make maintaining that connection harder. It also makes it even more important. We can't change our current reality, but we can change how we react to that stress. One of the most effective ways to reduce stress is to reduce your risk of infection. Wash your hands for at least 20 seconds. Use soap and water. Cover your coughs and sneezes. When you leave your home for essential trips to the grocery store or pharmacy, please remember to stay 6 feet apart from others. And remember, you are safer at home. Knowing that you are doing all you can to flatten the curve in our state can help relieve some of that worry. But sometimes these strategies aren't enough, and we want you to know that it's okay to ask for help. We know that feelings of isolation, economic hardship, or fear of getting sick, that all of these can pile up and make us feel overwhelmed, anxious, or depressed. Telling someone about these feelings isn't a sign of weakness. It can be a necessary tool to survive in this ever-changing situation. So I encourage everyone to visit resilient.wisconsin.gov to find the resources you need to build resilience and bounce back from this tremendous disruption in all of our lives. I now want to turn back to the numbers that I usually start with. So today, we have 22,377 negative tests in Wisconsin, 1,916 positive tests, and 37 deaths from COVID-19. Of those 6 new deaths, 1 is a male in Dane County in his 80s, 3 are Milwaukee County residents, a female in her 70s, a male in his 70s, and a female in her 80s. And the final 2 new deaths today are in Ozaukee County, a male in his 70s and a female in her 90s. Today, we have 2 additional counties reporting cases for the first time, Rusk and Barron. Our hearts are with the loved ones of the people who have passed, as we have said many times, and I know that you certainly share that sentiment. And we wish for those who have been diagnosed with COVID-19 a quick recovery. In all areas of public health, data is an important tool, and the numbers do tell us a story. This week, we added new information to our COVID-19 data webpage. In addition to case counts and case counts by county, we're now providing the number of hospitalizations, cases by date, and the cumulative total cases by date that have been confirmed. Keep watching, there is more to come. But collecting and disseminating data isn't as easy as 1, 2, 3. Our data team reviews each piece of information we collect for accuracy. And although it is a thorough process, when it comes to being transparent and providing you a true picture of that situation, it is important that we get it right. We look forward to bringing you more information as we continue to analyze and collect data on this pandemic and its effects on Wisconsin. As a final note, I want to point out that next week is Public Health Week. So I want to take this opportunity to acknowledge our local and tribal health officers who, like our healthcare providers, have been on the front lines since day one. You are true partners, and we could not respond to this pandemic without you. Finally, while the numbers may not seem like you're making a difference, believe me, you are. Please continue to remain patient and stay safer at home. With everyone doing their part, we will bounce back from this pandemic. Thank you.